Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning, good morning.
Good morning, Dr. Mencia. We had a wonderful sunrise again.
Oh, my God, so beautiful, so gorgeous sunrise.
So let's see, we finished with the 4th of July, and now, I don't know, now we're waiting for the Boomer Expo that's coming up, big time.
And one of my friends sent me this thought that I thought it was beautiful. You cannot help getting old, but you don't have to get old.
That's right.
Isn't that beautiful?
Yes, it's just a manner. Well, you know that more than anyone because you tell that to your patients all the time. I hate when people say to me, oh, well, they said I'm old, I'm this. What do you mean? Or they said, now I have to retire. Of course you don't have to retire. That's all just a myth.
Yeah, exactly.
You'll never retire, Dr.
I don't think
Mencia.
so.
You won't.
As long as I'm doing good and I'm bringing happiness to people and preventing people from having preventable diseases out there. I think, every day I'm happy to go to my office, every day. And I go there 7 days a week. I love it so much. I love what I do so much.
Well, you see miracles.
And then on Sundays, sometimes a person will pop up to your head on Sunday morning. And you say, let me go to the office and review the whole chart on this person. What did I miss? Or what else can I do different with this individual? I like that quote because you don't have to get old. As long as you are young as a spirit, and your voice will show that you feel young and happy as spirit. That's what counts.
This is what you like about me.
That's what I love about you.
I know. I know.
That's what I love about you.
No, it's true. It is really all how you feel inside.
How you feel, the attitude that you come,
right.
To face each day in life.
Right.
And for those of you that are homebound and, don't have a lot of friends or just relocated into a new town, it's the attitude that you go into your new life that will make things happen.
Okay, so how do you like this? Jim Hansen is the Seniors Helping Seniors, and I was thinking on July 4th, there were people who just were sitting at home. It was a holiday. They didn't have anyone. They could have hired his company for, let's say, 4 to 6 hours, just to say whatever it is. Maybe they'll wind up spending $100. I don't know. Mm-hmm. They could have been taken out to dinner. They could have been taken to see the fireworks. They could have had
come to my office.
Shopping. Yeah, I mean,
and do construction with me.
Yeah, well, that would keep them young. But
Grab a hammer there.
Well, but it's interesting. You should say that there are probably elder gentlemen who've done things like that, and then nobody wants them anymore. They just sit there. There's no use for them. Yeah. So that's the bad part. There needs to be some things that people can do that make them happy.
I was, I fixed the dental department. It's a brand new dental department.
Gorgeous.
It's so gorgeous.
Oh, it's gorgeous.
So now I'm working on the first floor. So the 4th of July, the office was closed. So I was just working on construction, bringing the wall down and tearing this.
Are you really?
And then this guy come by and say, oh, you closed today? I say, yeah, 4th of July. He's one of my patients, like 82. So he saw and he grabbed and he said, let me help you with. I said, wow, you are good at this. And he said, of course I'm good at this. That was all my life I did construction. And I said, oh my God. So I started grabbing stuff. I got scared. No, you're going to get hurt. He said, come on, let's do it together. And I was so happy. I'm so amazed. I say, I just love coming to work. Just love what I do so much.
It's your energy that draws these people there. You know that. That's really what it is. It's no other doctor that I've ever heard of. I know, but would even consider this. I mean, you're just so different. I wish this same pill that you're taking, we could give everybody that pill.
It's called the pill of love.
The pill of love. Yeah. But let me just say this, that you are so skilled. It's not just the pill of love. It's the pill of experience and what you've had. I mean, No, you're no young chicken. You're not 30
No,
anymore.
I'm 41.
Yeah, right. You're Jack Benny. But I mean, you act
32.
like you're young. But it's the youth that you have.
Of course.
So nobody even knows or cares, but you're like you just started from medical school again. You know, you're
exactly.
just out there so excited.
And people wake up every day looking at the half-empty cup.
Yeah.
And I just wake up every day looking at that beautiful half-filled cup of espresso.
Absolutely.
And I say, I am just going to enjoy every sip out of this thing.
Do you know that your wife, Rosemary, is really the same way? I've noticed both of you. When you go to see her, she's just hugs you. She's so positive. It's something must have been happening in your house.
Her big
your
mouth.
home.
Big mouth.
Her beautiful teeth.
Yeah.
Well, I want to talk about the heat and the sun because I was going to ask you a question. Snowy, as a dog, is she affected? Could she get skin cancer? Do you know? I know you're not a vet. But
I'm not a vet.
Someone said.
I think they can. It depends on how much hair they have, how much fur they really have. But I think the dog, if the skin get exposed, they can. When you look at human, it depends on the type of skin you have. So when it comes to skin cancer, which I think is a great topic for the summer now. So if you are fair skin with blonde or red hair, with blue or green eyes, or if your skin burn easily or develop freckles when you're exposed to the sun, those are the individuals that are at higher risk of developing skin cancer. So, the dog, I guess, they have, I'm not a vet, I don't know, but they have a very light skin or darker skin. And the hair, basically the color of the hair is the melatonin that determines the color of the hair. And I guess, I'm olive skin, dark,
I think I'm
dark.
olive
You
skin
olive
too,
skin.
yes.
I'm dark hair, which means I have a lot of melatonin. And the melatonin sort of protect your skin from the UV light. But the very fair person, the very light person with the red hair or the green eye, those people are so fair-skinned. I mean, they have no melatonin in their skin. And the lack of melatonin is what put them at risk of developing the skin cancer.
It's interesting you should say that. Bill comes from Irish and he's light-skinned because he has an awful lot of sun. I mean, he goes to the dermatologist, and I know you have a dermatologist at your
He's
office.
working today.
He's
talking
working
about skin
today.
cancer. Yeah, Dr. Labobian is going to be at the office today. So if you're listening to today's topic, let's call it skin cancer prevention, because it's all about prevention. And you want to get checked, you have concern, he's there. Come and see him.
All right, so what should someone be using now when they get up in the morning and a man shaves, a woman uses certain lotions, then they should put, even if they're not going outside, should they put on some sort of
sunblocker? Yes.
See,
because,
it's funny. I don't use one. I should be doing that, shouldn't I? And
of course.
I don't.
Yeah.
Sorry.
And I have one at the office that is produced by a company called Obagi.
I know them.
Obagi
very
was
fine
a
company.
very, I think it's still alive, because I went to a conference, one of the last conference before he retired. And he came down to Florida from LA, and I went to listen to him. And he had produced an excellent sunblocker. And the sunblocker he had produced is the same one you see on tennis player and baseball player. They put on their face when they eyes look really chalky, white, thick. And you can take the sunblocker and sort of protect the exposed area. So let's say if you are driving,
on your face.
If you put too much,
Oh, but
it will
you
be
don't
white.
want it.
You don't want to put. You just need a little bit of, and that's why it will last for a long time. Mine, I have it for a long time in my apartment. I just put a few drops in my face, and I don't drive a lot. I hate driving long distance. But let's say you have to drive 20 minutes to work and then 20 to 45 minutes going back home because of traffic, let's say. So imagine somebody sitting in the car, either passenger or the driver, every day. And if you are the driver, of course, you're going to put your hand on the steering wheel. So your hand is constantly exposed to the sun as you are driving the car. You're on the steering wheel, driving the car. You are not shifting gear. You just drive your car. So one side of your face where the sun is coming, let's say from the left, if you are the driver, and in front of you, and your hands, you're going to start seeing freckles coming on your hands as time go by. And when people come to get their aesthetic with me, I look at their face and I can tell which side of the face had been exposed the most. And there's one lady, she doesn't drive, but she go with her husband. They both work together. But she's the passenger. So they are both in my office and they came to get Botox. And I say, you are the driver. And I tell her, you are the passenger. And she goes, how do you know that? I say, because you have a lesion here on your left side of your face. And most of the wrinkles on your husband are the opposite. She was on the right side of her face, and he was all of the wrinkles more on the left than the right. So I say, and they say, you are right. That's what, he always drive. I don't even drive.
Dr. Mencia, I never think of being in the sun when I'm in my car.
I had a lady that came in that she worked at an office, and her desk is so that the sun, when it comes, it faces one side of her face. So she developed skin cancer on one side, on the right side of her hand and the right side of her face, because she goes and sits on that desk every day, and she's been working there for years. So it's sun exposure. So sunblocker, some people say, I'm not going to put on sunblocker. I'm going to my office. But, in my office, as you know, in the first floor, there's no window. So that would be okay not to put sunblocker if I'm on the first floor. But I go to the second floor a lot, and I do have window on the second floor. So if, being at work, being at home, you have window. First thing we do when we come from Georgia back to Pampano to your condominium, you open all the door, all the windows, right? And you let the sun come in. So as we get exposed every day and frequently to the sun, one of the best things we can do is always use sunblocker. Use a good sunblocker. If you come to Florida or you go to Hawaii or you go to one of the islands on vacation, if you're going to go swimming, use sunblocker before you leave your condominium or your room or your apartment or what have you, or your house. And as you go swimming, use sunblocker again and again so that you keep your skin protected.
I'm listening to you. I'm really listening hard because I don't use sunblock. Because this is my question: doesn't it? I always try to keep my pores clean. Doesn't it make your pores? I mean, if you're going to use makeup, do you put your makeup on after the sunblock, or tell me?
You put your makeup first. You can put your makeup first and then put the sunblocker. If depend on the skin complexion that you are. If you use a lot of makeup, if you're gonna use a lot of makeup, then you need the makeup to enhance certain part of your face. Then you use your toner first. You wash your skin. Then you use your toner. Then you use if you use vitamin C, which is I sell the concentrated vitamin C, and I use it myself on my skin. And then you put the sunblocker. Since I don't use makeup, I stop there. But then you can put your makeup right after your sunblocker. So
depending on I'm going to come and get this. What is the? Is it 30 or 40 or how does that all work?
34. And there are some that say 60. Really high. You don't need that. You don't need that. It's more the combination of product because the UV, the ultraviolet light, is a ray of light. So you can have a sunblocker that protect only against some of those spectrum of UV light. The one that we have done the research and we have gone with this company in particular, is because it protect against all the damaging UV light, all the ones that are damaging. Now,
who's I'm going to buy it. I have to come and buy it. So what do I ask for? What do I ask for when I come?
The Obagi sunblocker.
Is that the only one you have?
That's the only one we have.
So if I say I come in, I heard Dr. Mencia talk about it, I just ask for the sunblock, and they will sell that to me.
They will sell that to you.
I'm going to come and do that. And before I forget,
and if you have any of the lesion that we're going to be describing then about skin cancer, or if you are at risk, the dermatologist is there. If you want, just get
perfect.
in. So what are the risks?
Wait. Does someone before you do that, does someone need to make an appointment for the dermatologist? Today?
They can make an appointment. He will be there today. So if they come in, walk-ins are always welcome. Dental is open, so walk-in is always welcome for dental. As long as we are there, don't come after we leave. Because
all right, well, let me give everyone a phone number. Phone number for the
954
954 489 1345. 954 489 1345. That's Fort Lauderdale now.
1608 East Commercial Boulevard.
Right near Holy Cross, 1608 East Commercial. It's on the south side of Commercial Boulevard, and it's a wonderful. And there's a lot of reconstruction going on there.
We only move from there when the earth moved, but we are we try to stay put.
But don't forget that AGI Medical and Dental Centers, where Dr. Mencia is the founder, is also out there in Boynton Beach off Hagen Ranch Road. So you can call that other number, though, 954-489-1345. And if you need a home visit, they can provide that, and it's really available for homebound patients. Okay, so tell us about...
So the risk. Let me tell you who's at risk.
Okay.
Because, the young person, the skin is thicker, right? And the cells are being young, they can develop those melanocytes, are called those cells that produce melanoma that protect your skin. That's the natural way of doing it. As we age, we are at higher risk. So old age is one of the risk factors. If you have a weakened immune system, some people just go to a regular doctor and they don't get their immune system checked and say, how is my immune system? How am I doing? And there are certain parameters, even on the regular lab. Some people just bring me the lab from their previous doctor. And I say, let's do a more intensive. Let's see the dietitian so we can work on your immune system. For example, if the white blood cell counts are dropping, that's one of the protectors. Then the white blood cell breaks down into many different types of white blood cell. The granulocyte, the eosinophil, the this, the that. So lymphocyte. So you look at the different type of white blood cells, and if you see a decline on one of them, that's a little indication. So we look at the immune system on the person, and if you have a weakened immune system, that will put you at risk. Now, guess what? Between male and female, males are 2 times more likely to develop basal cell cancer, BCC, basal cell cancer, 2 times more likely than a female. So if you have a male and a female going biking without using sun protector, and he's at risk of BCC, basal cell cancer, for pencil talk listener, a male is 2 times more likely to develop basal cell cancer, and the male is 3 times more likely to develop squamous cell cancer. Same sun exposure, same genetic, all of that, just the sex different. We spoke about fair skin. So being fair skin, to remind the audience, those that just woke up late, being fair skin, blondie, red hair, blue eye or green eyes, and those people that burn easily or develop freckles when they get exposed to the sun. All those people are at risk of developing skin cancer. Now, how do I know? Because I'm not going to be running to Dr. Mencia or Dr. Abovian every time I see something on my skin. What are what we call the ABCD rules? So here go the alphabet. ABCD rules. Jot this down for people that take notes. The A mean asymmetry. That means if you look at a lesion in your skin, you take and you divide it in half. It could be top to bottom, left to right, makes no difference. You divide it you throw a imaginary line on that lesion and divide it in half. Is one side more or less equal to the other side? Is the lesion symmetrical? So let's say, a little ping pong ball, and you divide it in half, it's going to be symmetrical. But a pancake made by me is going to be completely asymmetrical. so if the lesion look asymmetrical, one side look different from the other side, it's very likely to be cancer, regardless of the side.
Really?
Number 2 are the borders of that lesion. If the border is nice and smooth, it's likely to be benign. But if you have little feet sticking out on the border trying to grow and take on the good skin, usually that's a very aggressive skin cancer. It's usually a malignant cancer, and most likely the squamous type that is much more aggressive. And when you see those little feet sticking out, imagine what's going deep into your skin. Bigger feet are going in. So it grows much faster into your skin because remember your blood vessels, the blood that is supplying the skin cancer is at the bottom of the skin. So
that's really interesting.
It's going to be chasing the food.
Oh my heavens! I'm just sitting here with my mouth open.
Yeah. The C is the color of the lesion. So if the color is very homogeneous, let's say it's all brown or it's all light pink, but if it is like light pink and then suddenly on one side of the lesion is dark, chocolate dark, brown on one side, pink on the other side, when you see different color on the lesion, that's a hint to look for to think of malignancy. And these are all important because your skin, even as you age, your skin is still thick enough that you can do good preventive medicine. And all I do in my office, I go underneath the lesion and I inject a little bit of anesthesia, like what we do when you go to dental work, same thing. We just inject a little bit of anesthesia underneath the lesion and that lifts up the lesion. And then we take a pen, it's a cauterizing pen, that when you press on that pen, the temperature go to 2000 degrees. So instead of cutting
like
with
a microwave.
Right. So instead of cutting with the knife, we just take that little pen and we just tap on the corner of the lesion. And we can lift it up and take it out. And there's minimal bleeding, unless it's a deep malignant, because remember, malignant bring a lot of blood vessel into it. If it's a benign lesion or a lesion that is turning cancerous, we can lift it up off your skin, and then you're going to heal, and at least you won't have that skin cancer spreading through other parts of your body. So color is the C, and the D is for diameter. So if we measure the skin cancer, any lesion that is bigger than 1/4 of an inch, or for people that listen to us from Germany, if it's bigger than 6 millimeters in diameter. So from corner to corner, the bigger you look at the side, don't cheat yourself and say, from here to here is smaller, so I'm going to measure there. Look at the bigger, side to side and measure that line. The one home measurement tape that we have is the eraser. You take the eraser of a pencil and you put it on top of the lesion. The eraser is about, if you measure the eraser of a pencil, it's about 6 millimeters in diameter. So if the eraser covers the lesion, it's less than. If the lesion comes outside that eraser, then that lesion is big enough to be seen by a dermatologist or a primary care doctor that is conscious of skin cancer and prevention from spreading out.
We've never done this before, Dr. Mencia.
No.
Thank you for doing this.
And skin cancer, if you have skin, you can develop cancer. That's, the way. So can it be around the, let's say I have a patient that I have to send to Miami. And unfortunately, he had a lesion in the ear canal. And the cancer has spread so deep into the ear canal.
Whoa.
That they have to remove the entire earlobe.
Dr. Mencia.
The entire earlobe. And then take a piece of skin to put a skin graft in there. So he has absolutely no ear now.
Oh, my. And how did you discover the cancer in the ear?
Because he was complaining of sinus congestion. He didn't even complain of anything on the ear. He just gonna say, I feel congested in my sinuses, and I was flying, and then it went into my throat, and I went to the middle of my ear, but it's sinus, just my sinus. I'm just bringing a lot of green junk. So if you listen to the description that he was giving, you would never even think, ear, it's just sinus infection. But when we did the examination and we'll check for lymph node and we check what the ear, nose, and throat doctor would have done, then I look at that lesion and I say, well, how long you have this thing here in your ear? Hardly to even look at your tympanic membrane. And he said, I've never been told of having anything there. So I said, you know what? Let me send you and let's get a biopsy of this.
Oh, Dr. Mencia, that's
so we
great.
took a biopsy. Great. We saved his life because, as you can imagine, for those of you, I have one of our listeners. She's a retired nurse practitioner. Oh, what a beautiful lady. She came to see me and she said, how long it took me to get here? An hour. She came from Pembroke Pines or something. And she drove 441 and then Commercial Boulevard. So I said, I have to open an office south because of her.
Well, we're going to do that.
When I saw the lesion, we said, let's biopsy this. I said, I'm not going to biopsy this. I want to send you to a specialist because I want to get a good chunk of what's there. I don't like when I look at the ABCD in my mind, I just didn't like the lesion at all. So it was cancerous. It was invasive. It was very aggressive.
Oh, my heavens.
And being in a location like that, it just keep growing. You don't even know you have it there. So, behind your earlobe, when you check your skin, check behind your earlobes, check everywhere in your skin, especially those areas that you expose a lot. Yes. So that's why we tell people when you wear a hat, if you are prone to skin cancer, you want to wear a hat with a big rim.
Yes.
To really protect you.
Dr. Mencia, we've run out of time, but I want to give yes.
I don't
want to go. The number is 954-489-1345. Go there today. Get yourself checked. I'm going to go buy this sunblocker. Save me one. I got to get my vitamin D. I've run out of that also, so I need everything from you. Thank you very much, Dr. Mencia. Have a great weekend.
Thank you, Anita. Always a pleasure.
Always for me also and for our guests. And we're going to be talking to our next guest just shortly. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.